So welcome everybody. Some of you all joined us for the first part of this series in June. This is actually part two, where we're looking at supporting mental well-being in the workplace. I am Kim Releford. I am one of the therapists here at Health and Wellness, and one of four. And I also wanted to give credit to Rhonda Henry, who's another one of the therapists here, because she helped me with some of these slides that we've used in other presentations. And I wanted to make sure she got credit for that work. So anyway, so today, and just before we get started, I'll just let you know that there will be a third piece to this series on August 29th from noon to 1. That session will focus on practical tips for responding to an employee struggling with mental health issues and how that impacts their work performance and behaviors, and having those tough conversations with compassion. And that presentation is called How to Support Employee Mental Health. So I hope you all will join us for that if you are able to. Okay, so let's go ahead and get started. So today we are talking about self-care for supervisors, and we're going to be focusing on increasing the ability of managers and supervisors to manage their stress and model stress self-care strategies in the workplace, because everything begins at the top. And if you want a culture of well-being, you also have to take care of yourself and your team. So throughout the training, I'm probably going to use manager and supervisor interchangeably. And I know that they tend to have two different meanings, but regardless of that title, both managers and supervisors oversee the work of others. So I'm going to be, so just so you know, that's what that might happen. As a leader, regardless of manager or supervisor, there is inherent stress in being a leader, and regardless of where you land in that management hierarchy. And so today we're going to be focusing on developing a self-care plan for supervisors. Right. So today we're going to talk about what is self-care and why is it important. We're going to talk about burnout risk and factors, and we're going to talk about how to start the building of a self-care plan. So before we talk about what self-care is, let's talk about what self-care is not. A lot of people, when, they think, some people, not all people, some people think of self-care as this kind of overindulgence in spending. They may say, oh, I'm doing self-care, I'm going to eat this whole cake. They might participate in activities that provide instant gratification, going on expensive and lavish vacations for self-care, numbing out bad feelings, binge watching TV. And in and of themselves, some of those are not such a bad thing, but they're not necessarily going to provide self-care. They might provide distraction, they might provide a break from stress, but self-care overall is more than that. One thing that self-care is not is it is not selfish. So, when you think about selfishness, a lot of people, think about being selfless, like putting others before themselves. But self-care is selfish with the little s, meaning managing our own well-being, and that's not selfish. And then because when we take care of ourselves, it empowers us to be better friends and parents and coworkers, and better in our relationships, and just generally better humans overall. And so we also just don't have to justify it. Just because it makes us better in our relationships doesn't mean that's the reason we do it. We do it because caring for ourselves is reason enough, and we don't have to justify it by helping others. So our own needs, meeting our needs through self-care, is not selfish, and it doesn't have to be justified by how it helps others, only how it helps ourselves. So it's also not an excuse. So self-care isn't making ourselves feel good by any means necessary, which were some of those ideas that I had a moment ago. It also doesn't mean that it can't be an instrument of selfishness. So that's the difference between selfish, little s, and selfish, big S, is when it is taking away from other people. It is a selfishness. It's not an excuse or for bad or irresponsible behavior. Oh, I'm going to blow off everybody at dinner tonight because it's self-care, or, I'm going to come in, and miss that meeting, self-care, things like that are actually can be considered selfish because in the name of self-care. Self-care is also not self-reliant. And I think that that's really important to kind of lean into for a moment, is the idea that, and acknowledging the fact that we as individuals can manage our self-care, but we can't do it alone. Oftentimes, self-care requires us to lean into other resources and ask and seek help. And sometimes that includes professional help when needed. Self-care is also not one size fits all. One tool in your self-care toolbox is not going to address everything that you need when you need some self-care. So if you're dealing with sadness, the same tool that may help you with your sadness is not going to manage your anger or your anxiety. Right? It might be helpful, but it's not going to be the tool that you need. And so self-care needs to be a lot of different tools to address a lot of different issues. And we're definitely going to be talking about that as we go along. And also back to that one size fits all, it's like a lot of times when we think about self-care, we think about massages, we think about meditation, but sometimes when we push just one way of doing things like meditation, that really leaves out other things that might be more beneficial to us. And some people just cannot meditate. They just can't. It is not something I can't do it. I mean, I have gone to trainings, I have tried it. My brain does not shut off. It makes me nervous and anxious to even try because I can't get there. It is not worth my frustration, right? So my tool needs to meet my own personal needs as well. So, if it doesn't work for you, don't do it. So that's why it's also not one size fits all, because what works for you may not work for me and vice versa. And finally, self-care is not a cure, because it is not something that's going to fix all of your ailments. It's not going to make you not be stressed or not have deal with things in your life that are stressful. What self-care is the ability to build up your resources and your reserves so that when life is difficult, you have the capacity to manage that your stress tolerance is higher because you've been managing your self-care. So self-care is any activity that we do deliberately in order to take care of our mental, emotional, and physical health. It's investing in self-care makes us more resilient, able to manage adversity more effectively. And we also need what's called community care, which goes back to the ideal of it not being all about self-reliance, because sometimes self-care means leaning into our community, making sure that we're taking care of ourselves as a collective, not just our individual selves. So self-care can also include community care, and as supervisors and managers, that is the care and compassion for our teams and modeling what that looks like. And I really like this quote: self-care needs to be included in what you should be doing. It is not a privilege, it is a necessity. It's not something that you get to do because it's a good thing to do. It is something you absolutely need to do. So thinking about that, that could be things like making sure you eat a healthy diet, exercising, getting enough sleep. If you have a chronic issue, making sure you're following your treatment plan, taking your medicine, taking time out for yourself, and participating in healthy activities you enjoy. And pleasure and joy and enjoyment are self-care, because that is a need we have as humans to lean into that as well. So why is self-care so important? So here are some of the reasons that I wanted to touch on. The first is going back to the idea of managing chronic conditions. When we practice physical and mental self-care strategies, conditions such as depression, diabetes, heart disease, chronic pain issues are easier to manage. At the same time, it also helps to prevent diseases, such as implementing self-care strategies such as regular exercise, healthy eating, using stress management techniques. Those all reduce heart attacks and stroke, and even reduce obesity that can cause those things in the future. And then there's stress reduction. That is a really important part of self-care as well, because it impacts the whole body. Stress impacts our entire body, and it can lead to those chronic health conditions. So when we're not managing our stress then it impacts our health, not just emotionally, but physically as well. When we practice self-care, it actually can lead to healthier relationships, but not only because we're taking better care of our own personal needs, but we're able to engage in healthy relationships, partially due to the fact that we have increased self-esteem and self-worth. We're more likely to, value and to put time and energy into our healthier relationships, and we'll be able to identify which relationships are more healthy when we feel that better about ourselves, and we feel that sense of self-worth. It helps with overall improved job satisfaction. Even when even when the job itself is stressful, or there are things that are not, that are not going well, maybe within the organization. When we are practicing self-care with intention, and it can actually help us to manage our stress even in times of adversity, and that we can find ways to find meaning within our job that can lead to job satisfactions regardless of what else is going on. And then it obviously helps to reduce burnout. And we're going to talk about that a little bit here in a moment. But, burnout, self-care strategies is one of the easiest ways to avoid burnout, but it's an intentional self-care. You can't do it after, it helps to reduce stress, but it also helps to avoid stress. So having a good self-care plan up front that you're practicing on a routine basis, that's part of who you are, not just something you reach for in an emergency as an SOS kit, can actually reduce the chance of burnout and reduce burnout when it occurs. And then overall, self-care helps improve our quality of life. When self-care practices, they can help us to manage our conditions. Like we said, it reduces all types of stress. It makes us feel that greater sense of belonging. And we have that overall improved well-being and quality of life. Okay, so this last time when we spoke about this, we were talking about what wellness and well-being were and how that leads to burnout, not only within ourselves, but our employees. But for this, I wanted to talk about what burnout and how burnout affects managers and supervisors. So what causes burnout? So burnout is that, just as a reminder, it's that idea that we are no longer able to, or we have high level of professionalism that I'm missing this up. Anyway, I had a thought and then I lost it. So anyway, burnout is that idea that we have nothing left to give. Like if you think about, we run out of fuel, or our engines are low, we can actually burn up our engines because we don't have enough energy to do things anymore. What causes burnout are things like diminishing trust, increasing workloads, continuous crisis mode, diminishing resources, recurrent disruptions, and social injustice issues at work and in our community and in our society. These things can cause burnout. They impact us. But how does that impact managers? What does that look like in managers? It can look like exhaustion, whether it's physical exhaustion, mental exhaustion, emotional fatigue. It makes it hard to get the work done effectively and feel positive. We might start dreading coming to work. We just don't want to be there. Decreased compassion, having less compassion to show for our colleagues and our employees. We might have difficulty regulating our emotions and, just having no control over our emotions, feeling excessively angry or excessively sad, having that continuum be like a lot greater when we're feeling our emotions. It might lead to circular or obsessive thinking about things, getting stuck on things, that intrusive worry that can happen. And then it could lead to low motivation. So we just don't feel like doing things anymore, and we don't feel like ourselves. We could even, we completely feel disconnected from ourselves, not just our work. So these are overall risk factors for burnout, but I want you to pay attention to them and maybe make a note of any of these that might be risks for you as we go through them. So work and home conflicts, feeling like you're not effective at your job. Young professionals and women are even more at risk for burnout than other professionals. Being new to work, trying to prove yourself, time for unmeaningful work, how much time it takes to do things that you don't find meaning in. Maybe you're parenting young children, so your brain is like stretched in many, many different ways, or you're caring for an elder. You might have a history of personal trauma and anxiety and mood disorders, which makes your stress tolerance lower, which makes your increased your risk for burnout. Unsupportive work environment, high workloads, long work hours, things don't go quite the way they should, feeling like you don't have input or respect in your work life, feeling highly criticized, but not feeling like you're getting any empathy from leaderships or supervisors, ongoing conflicts with coworkers, limited advancement opportunities, and being on call nights and weekends are all risk for burnout. For managers, there are even more risks. And here are just a few that I wanted to touch on, because we could go on and on about these, and you probably even can think of some yourselves. But a couple that I wanted to touch on today was some that are most common causes of burnout in managers. First one is the dual role of doing their work and managing. Many managers today not only have a team that they supervise, but they also have a job that they're doing, because we have a lot of hybrid supervisors that are half doing the task and half supervising others that are doing that task, or just getting their work done of a manager, the things that need to be done in order to make sure that the unit or the team operates efficiently. So trying to manage both of those things can be really difficult. Too many distractions, too many irons in the fire, being pulled in too many different directions, putting out fires and crises all the time, too many distractions. And so just feeling exhausted and like feeling like nothing actually got done during the day. Due to being a manager, the nature of the manager's role has changed over time. It goes back to the idea that there was once upon a time, managers' job was to delegate tasks to members of their team and to ensure that your work gets done. But what we've learned over time and what we have evolved into is understanding that supervisors and managers impact the well-being of their employees. And when we provide compassion and support to our employees, we actually make our work, they can work more efficiently, and they're more loyal, and they have more investment in the work that they're doing. And so supervisors' roles and managers' roles have changed in order to also being like the lead in providing that kind of wellness and well-being within their team at work. But who takes care of the manager? Right? Are their higher ups also providing that support? Where is the manager getting that as well? New to being a manager, this is a really hard one, particularly for someone who has been doing the work. Like, UK is pretty good about promoting from within, and we like to promote people who are really good at their job, right? That's why we want them to supervise people who are doing the job that they've been doing, because they're really good at it. But sometimes people who are really good at their job are also type A types of people, and they tend to, see that this, they know how to do it right and they know how to get it done right. But what happens is that they supervise people who may not have the same values and expectations around work, and they get really frustrated when other people don't quite work up to the same level they do. They have too high of expectations for their team, but also they may not have the training and know how to be a manager or supervisor. So just because you know how to do a job doesn't mean that you know how to supervise people who do that job. And so making sure that they have that orientation training that they need and support and feedback is a way to combat that burnout. Lack of overall support can also be an issue for manager burnout. And managing remote and hybrid teams, particularly since COVID. This is something that we're all kind of, whether you're an employee or you're the supervisor, how do you manage that? How do you continue to keep your team engaged with each other? How do you ensure that the work gets done? Even sometimes when work is done in different buildings, it doesn't even have to be our teams are not always like, your units are not always in one building anymore, or even on one floor. And so managing that, making sure the work gets done, making sure that people have what they need in order to do their job. This has made the job of being a manager or supervisor just a little bit harder. Okay, so one thing I would like to really kind of emphasize today is that for managers, one of the main self-care strategies for managers is boundaries. And when we don't have good, strong boundaries, our stress levels go up, and manager burnout is more likely to happen. So ask yourself, or if you've ever fallen into any of these pitfalls as a manager: doing work for others, doing tasks alone that are intended for more than one person, saying yes to tasks you can't responsibly complete. So, when we know how to do something really well, sometimes it's just easier to do it ourselves than to delegate it or to train someone else to do it. So we might find ourselves saying, oh, I'll take care of that. I'll take care of that. Let me do that. I'll take care of that. Instead of taking the moment or a time to like train somebody how to do it, or allowing it to be done, maybe not as fast as you would like, or, but it gets done. And so those expectations of ourselves and others, but also like just not allowing ourselves to delegate, and always thinking that we have to get it done and get it done as quickly as possible. Taking on more than you can handle, working during downtime, Working without pay, meaning working past your work hours, way past your work hours, or working, if you're an hourly person, clocking out but continuing to work, these lead to burnout. Failing to delegate, failing to not take your time off, flirting and gossiping with your employees can be a boundary violation. It is a boundary violation, but also is a slippery slope, because it might be you're just having fun, but it can be misconstrued. Being asked about personal issues unrelated to work, like that's a really difficult boundary to decide for yourself, because every supervisor and manager has to decide what that looks like, about how much personal that they share. And so, thinking about that, like what is too much, and how does that impact the work getting done as well. So boundaries are definitely a place where managers are more at risk for burnout. So how do we manage all this? So well, I mentioned earlier that self-care is hard when we're stressed, like figuring out what we need for self-care, implementing self-care when we're already in fight, flight, freeze mode, and our brain is, our perspective is narrowed, and we don't see we have any options. We're already like feeling stuck, or we're so busy trying to solve problems that we're in that doing mode instead of switching to being mode. Self-care allows us to be a human being instead of a human doing all the time. And that's exactly what we often need. But when we're kind of get stuck in that doing, we don't have that self-care, those go-to things that we know to do. And that's the next part. It's like we need to have that list of go-to activities or self-care activities. It's difficult to think of options in that moment of stress. And it can be helpful to have a list on hand with a variety of activities to pull from. So for the rest of our time, I want to focus on making a self-care plan. And as we move through the slides, I want you to make notes of skills or strategies you would like to include in your self-care plan, or even areas that you need to work on. And I will be sending these slides as a PDF to everybody that signed up for the session today. So you will be getting those. So just jot down some notes to remind you, so that when you get the slides, you know where that information goes. Okay. So what we're talking about is radical self-care. And I talked earlier about like that self-care is not self-indulgence. There's a difference between self-indulgence and self-protection. And I would also add not just self-protection, but self-prevention. Right. So in order to practice radical self-care, we need to embrace practices that keep us physically and psychologically healthy and fit. We have to make that time to reflect on what matters most to us. We challenge ourselves to grow, and we check in with ourselves to ensure that we are doing things that align with what matters to us. Eric Wilkinson, one of the therapists here at Health and Wellness, is just completing a series of trainings on radical self-care and self-compassion. I'd really like to encourage you all to look for that for the next round, because I think that, because we obviously don't have time to spend on it as much as I would have liked to today, but you definitely should check out Eric's workshop. Okay, so when we're talking about healthcare, self-care, we're looking at 4 dimensions. And anytime you see that little orange asterisk on a slide, that's a place where you might want to make some notes. So when you can come back to the slide later, you can think, oh yeah, I thought that was something I might want to pay more attention to. So if you think about the dimensions of self-care, these are the 4 dimensions: body, mind, spirit, and relationships. So body are things like movement and sleep and nutrition, going to the doctor. Mind are things like savoring our time, self-compassion, goal setting, doing things that are keeping a growth mindset, doing things that are intellectually stimulating. Um, Relationship bound self-care is things like good communication with those who are important to us, people who fill us up, having good boundaries, addressing conflict when it arises, investing in our connections, building new relationships in places where we need them, and distinguishing between healthy and unhealthy bonds, which goes back to building up our self-esteem and self-worth so that we lean into those healthy relationships and not the unhealthy ones. And then the last one is spirit. And so that's that connection to something bigger than you are. And a lot of times we interchangeably use the words spirituality and religion. So religion can be a way that we practice spirituality, but spirituality is actually an aspect of being human. All of us as a whole, when we think of ourselves as holistic beings. Spirituality is part of that. What that looks like can be very different for everybody, but it's that connection to something greater than ourselves. It's maybe living authentically, feeling like our best, most authentic self, living into our values. It might be cultivating curiosity and learning, exploring creativity, but regardless of what it is, it's about making meaning and feeling connected to something bigger. And some of us might follow rituals or practice that reinforces that connection, but it's definitely bigger than just one specific thing when you're talking about spirituality. So any of those that I mentioned or any that I may not have mentioned that you noticed, go ahead and jot those down so that you can come back to them. So thinking about relationships and that being a dimension of self-care, I mentioned boundaries earlier. For managers and supervisors, it is one of the primary things that you can use for self-care at work. It's also a great tool to teach and to model for your employees because it is definitely one of the easiest, not easiest, boundaries are not easy. It is one of the most effective ways to manage your self-care at work. So let's talk about boundaries. So I want you to take a minute and look at these questions. And if you're a manager and supervisor, you know that being a manager and a supervisor is all about relationships, and all relationships need clarity. And when we have a lack of boundaries between ourselves and our employees, we can start feeling overworked, misunderstandings happen, poor communication, and we tend up having resentments towards our colleagues in the work in general. So thinking about these questions, if you answered yes to any of these questions, you may need to revisit your boundaries. So because strong leaders have strong boundaries, and we want to make sure that we're setting and maintaining boundaries that are important, not only for our work-life balance, but for our employees' work-life balances as well. And boundaries can be best described as the limits you set on your time, space, and energy to protect your emotional well-being and health. And it's not just protecting your own personal time and well-being, but it's also making you a more effective and productive leader. So we not only need to respect our own boundaries, but encourage our employees to do the same. So let's talk about how we might set boundaries or revisit our boundaries. So first of all, it's about clearly defining your boundaries. Start by identifying what your personal boundaries are, such as how much time you're willing to commit to work, what kind of work you're willing to assume. Spell out your boundaries and share them with your team so everyone is on the same page. And then communicating your boundaries, making sure everyone knows your boundaries and why they are important. Because we can all have boundaries, and some boundaries are unspoken. But as managers and leaders, if we don't communicate those to our staff, they don't know where they lie. And I will say that what I know for me, a pitfall is about how accessible I was to my staff when I was a supervisor. One thing that as a younger supervisor, as a newer supervisor, that I really struggled with was being overly accessible. Because I wanted to be helpful, and I wanted to be that person that they could come to and they could ask for help when they needed it. But what happened was I became the person that they came to and asked for everything. So I'm sure that as managers and supervisors, you sent out memos, sent emails, had meetings about things, and the anticipation and expectation was that the employees would retain that information and then use it when it was necessary to deploy that information or employ that information. And then what happened was they just came and asked you when it came up, right? Because we have become so accessible that they just come and ask us. And I am guilty of that too. If I know that I don't have to remember something because I can just go ask the person and they'll tell me every time, and not set a boundary that says, hey, I need you to go read that email before you come in here and ask me about it. If you don't understand the email, then we could talk. Then I'm going to be answering questions like an open door, revolving door, day after day. And people are not going to take responsibility for that. I wouldn't, because why would I? If I come and ask you, you're going to tell me. So, and then we have to enforce and stick to our boundaries, saying no. No is a sentence all in within itself. And sometimes it's also no right now, not right now, or yes, I know that's important to you. However, that's not something that I could provide right now, but no is important, and enforcing the boundaries that we have set is important. We also need to encourage others to set their own boundaries. I don't have it on my signature block, block, but I really like where I've seen a lot of people have on their signature block now that you may receive this email outside your normal working hours. However, my expectation is not that you answer that email at this time, so that you know they're saying, I know I'm working and it's not your work hours, but I don't expect you to be responsive to this email immediately. I realize that you are at home and you're in your life, and I don't expect you to do that. I think that that's a nice way to model good boundaries, but also to encourage others to do so as well. And then also we need to revisit our boundaries routinely. So thinking about boundaries, we try them. Sometimes we pilot a boundary, like, an open door policy may be too open. And so we're going to say, okay, I am available to anybody and anybody's questions between 2 and 4 every day. Well, I still need more time than that. 2 to 4 is too big of a time period. So maybe now it's 3 to 4 every day. So I need to revisit or revise that. I also might need, I might say, yes, please come and ask me questions. And then all I feel like I do is help employees problem solve, and I'm not teaching them to critically think for themselves. And so one thing that I also learned as a young supervisor was that, when people bring me problems, I can ask them what they think they should do and help them to learn to make their own. And I actually, during orientation and reinforced with my staff often, was come to me anytime you need to, but come to me with a solution, not a problem. If you're not sure, and there might be some times when you don't know what the solution is, and that's fine too, but come to me and tell me what you're thinking and what you think you should do in that situation. And I'll say yes or no, and then we'll talk about it. But that way you're not constantly having to have long conversations about things, because you're also training your staff to have really good critical thinking skills. And then you can launch them and let them have more autonomy and more control over their own work, because you trust their thinking, because you've seen their problem solving and prayer interesting. So revisiting and revising routinely is important too. Part of setting boundaries is learning to say no. And I've really leaned into this idea of every time you say yes to something, you are saying no to something else. You are a finite commodity or resource. There's only so much of you to go around. And so if you keep saying yes and keep saying yes, you are automatically something else. You're saying something else, no to something else. And it may not be something that you actually are saying, no, I'm not going to do this. It could be things that you get behind on, or you forget about, or balls get dropped, or it's on your to-do list at the very bottom, but you may never get to it because other things become a priority. And so ways to think about when you say yes, what are you saying no to? Asking yourself that each time. Is there something you can delegate to make more time for this new project? Is there something you can eliminate? A lot of times we get really set in our ways about how things should go. Like we want to make sure that we rewrite our to-do list every day, or we want to immediately respond to emails, or whatever it is that it's our preference about how we do our work. But that may not work well when we're trying to manage multiple things. And so what can you eliminate? Can it wait? Is there other things on your list that can really wait? They're good things to do. They're important, but they don't necessarily are not a priority right now. So they might be things that can wait. Prioritizing. And sometimes when we're asked to do new projects, whether we're asking our employees to do that or we're being asked ourselves, it's really hard to determine what a priority is, because everything's a priority because it's important. And so sometimes it's about asking that question, like, yes, I can absolutely take on that project. However, I'm going to need you to help me figure out, what are these other 3 things that I'm working on right now? Would you like me to back burner? Or what can I deprioritize in order to put this on the front burner? So we're actually negotiating that up front, so that you don't have to feel like you're trying to do everything, because you've already agreed upon what can wait, what is a priority now. Determine what is important to you and what do you value. And if you take on something new, what are you going to stop doing? That's like probably the bigger of the questions there. So that's the use of no as a way to set boundaries. Okay. For these last few minutes, I want to talk about generating some self-care ideas. So going back, so for each of those 4 dimensions, body, mind, relationships, and spirit, I want you to ask yourselves, what is something you're doing now to take care of your body? And what's something you'd like, one additional thing you'd like to care for your body now? So for body, for mind, for relationship with spirits, what's one thing you're doing now? And what's one additional thing you'd like to do or to nurture or to add? So I'm going to go ahead and switch back over to those dimensions so that you can like give you some ideas there. So, in body, are you really good at adhering to your medication regimen? Because that's important, but you're not so good at making sure that you routinely go to the doctor. So maybe that's something you might add. So thinking about these 4 dimensions, what's something you're doing now and what's something you might add. Just gonna take a moment for that. There may not be an ideal on these on this page, but I'm going to have some other ideas too. So I'm going to move forward with that. But I just want you to be continuing. What am I doing? What's one thing I might be able to add as a way to start this idea of a self-care plan? So the information we're going to go over now is directly comes from this book, The More or Less Definitive Guide to Self-Care, which Rhonda found and then I read and love. I think it's a great book. It doesn't try to sell you on self-care, because I think that we could all agree that self-care is a good idea to do, but it does say, how do you decide what kind of self-care you need and what are some ideas? When do you deploy different types of self-care? So this is that definitive guide to self-care. And what I really like about it is that it's free on Kindle Unlimited right now. So if you have a chance, make sure to check that out, like free things. This is from the back of the book. This is another thing I really like. So what the book has is A to Z different types of self-care activities, right? So it goes over it, it explains it, it gives you an idea about it, like, and then it gives you, so some of these, expecto patronum, that doesn't make any sense to us, but if you read the book, it would be under the E's, right? And so what I like about this and what we're going to spend some time on is that it helps you decide what you need when. And so the first question is, how do you feel right now? And Rhonda made this a little bit bigger for us to look at. She used it in a presentation recently. And so I think it'll be a little easier, but I really love this. It's in the back of the book and it's just really easy to say, okay, what's going on with me? I'm stressed and overwhelmed. Been there. What's my priority now? Getting stuff done. Okay, I'm going to ask for help. Like, this is a really nice way to like think about what is you need for self-care and have that easily at your fingertips. So how does this work? Okay, so the first question is going to be, how do you feel? And so if you're okay, you might enjoy doing something productive or like to do something that relax or have fun. If you're stressed and overwhelmed, you might need to do you need to get some things done? If so, these are things you could do stressed and overwhelmed. Do you need to get grounded or relaxed? Here are some things to do that. And so for each of these questions, am I okay, stressed or overwhelmed, lots of emotions are really awful, it breaks that down to you and asks you questions to help you decide what you might need. So here it is in a little bit bigger. So how are you feeling? I'm okay, but I want to practice some good self-care. So I could enjoy doing something productive. So my self-care activity might be to clean or organize a closet. I might go out and volunteer. I might look at my life goals or my work goals and audit those. What's an idea that you could do right then? I'm okay, and I can enjoy doing something productive. So when you get the slides, you might go back and write your ideas here or just jot them down as we go along too, because I'd really like you to have some ideas coming out of the presentation that you might be able to implement. So what's something you could do that would be that would be something productive when you're just feeling okay? Maybe you want to have fun or relax. So here are some ideas there. You might go gardening or do some skincare activities, proactive communication, spending time with friends, like calling up, like, hey, I just wanted to text you to tell you hi, or here's a funny meme, that connection piece, or spend some time in nature. Those might be some things you do when you're feeling okay. But what about when you're stressed and overwhelmed? Then you might ask yourself, do I need to get things done? Or do I need to get grounded or relaxed? Because it's getting things done going to help me work myself out of stressed and overwhelmed, or getting some time away and grounding and relaxing. Is that going to help me out of stressed and overwhelmed? So if you need to get things done, you might need to ask for help. Or you might need to do a brain dump, whether it's in a journal or just going and talking to people and, just say, and we do this a lot here. I need 5 minutes. I'm going to download on you. You don't have to do anything with it. I don't need a solution. I just need to say the words out loud because I need them out of my head. Brain dump, right? Declutter. You might clean off your desk. You might actually write a done list instead of a to-do list to remind yourself that you have done a whole lot of things. It may not feel like it because your to-do list is so long. You might put your phone on do not disturb. If you need to get grounded or relaxed, you might try some breathing exercises or take some breaks or cook. Make a list of things that you enjoy doing that you're looking forward to, like a list of all, you might even make a list of things like all of the things that you love that are purple, because your brain will have something to chew on, but it's like an easy thing to do. It's a relaxing thing to do. You might meditate, you might spend time in nature, or you might use some self-talk to get yourself out of it. So for you all, what would you do to need to get things done? What would you do if you need to get some things done as a self-care activity? And what would you do to get yourself grounded or relaxed? So jot some ideas down there. So the next one is lots of emotions. Do you want to shift your attention? So when you think about emotions, you have the option to repress, express, and calm. And all three of those at different times are important, right? So in the middle of a crisis, you don't have time to feel your own emotions if you're the person that's managing the crisis. And so you're going to need to repress those feelings and lean into something and move on and move forward. But then you're going to need to come back to them. I have a colleague who always says, you can't go around emotions, you can only go through them. Because and I always, whenever she says that, I always think about somebody just going around and around the emotion, because you're not going around them and moving on, right? You're just circling the emotion because you're not getting anywhere. But if you go through the emotion, you're actually going to be able to move through that and move past it. So sometimes when we have lots of emotions, we need to engage with those emotions. And that's when we might need to breathe or cry or journal about it or name what's upsetting you. So sometimes when you think about, I'm really feeling upset, I think this is what's upsetting me. No, what I think it really might be, and figuring out and being able to name that is a way to engage an emotion, letting it out, talking about your feelings, maybe going to therapy. So what are your ideas? What are ways that you engage with your emotions? Maybe sometimes you just don't have the energy for that. You just need a break from all your emotions. And so you might color or cook or dance or drive or do a puzzle. There might be a distraction, right? That might be more of a calming thing that you would do. Instead of expressing, which is engaging with the emotions, you might need to shift your attention and calm. And here's some things you might do with that. So think of those ideas for yourself. Okay, so how are you feeling? Really awful. We all have those really awful days. How much effort can you give something? As little as possible. This is the time to ask for help. Maybe all you can do is change your clothes and drink some water. Maybe all you can do that day is take your medications. Maybe somebody's asking too much of you, and the little as possible is just to say no and walk away. This is a time to deploy self-compassion and ask yourself what you need. Maybe you need a hug, or maybe you need time to unplug. If you could do a little bit more on a really awful day, maybe that's a good time to take a bath or to take a shower. Some days when it's really hard, especially when people with depression know this, sometimes taking a shower is the thing that you did that day. It was the big thing, like you've had a win. Maybe you need to eat something, or just get out of your environment, or get out of the house and drive around. Maybe there's something you need to indulge with, something that's gives you pleasure. Reach out to a loved one, read, identify problems, or just simply make your bed. The ideal here is this: it doesn't have to be a big thing, but it just needs to be a thing. So, what would you do when you're feeling really awful? Maybe if you just feel like all you can do is a little as possible, but something you could do. And maybe if you have a little bit more energy, what's something else you could do? Okay. So the idea of having a plan is really great, but they're staying on track requires some overcoming of barriers. The first of that is the necessity of plan B. So we could have the best self-care plan in the world, or a self-care activity that we as our routine. It's like the pillar of your self-care, and all of a sudden it's not working anymore, or it is not available to you, and you have no plan B. I have personally am living this right now. So I go get a massage every other week for 10 years. it helps with chronic pain and some other issues I deal with. It also helps with relaxation and letting go. It's that moment of time where I am being cared for and not caring for others. It is one of the pillars of my self-care. I tell people that going to the chiropractor, click list, and going for a massage are my 3 pillars of self-care. Okay, so those become very important. Well, this summer, my massage therapist broke her wrist, and I have no plan B. I actually burst into tears. I mean, I was really sorry for her, and I was glad that she was going to be okay and she was going to have surgery, because I really care about her, because after 10 years to become friends. But I also felt really bad for me too, because what was I going to do? I have no plan B. And so there is a necessity to have a plan B. And so what I've ended up doing is, like, I'm going to Lexington Healing Arts, which is always a great place to try. And I'm trying out other massage therapists. And I can assure you that I will have at least 2 or 3 people that I know will be a good alternative if I need a plan B again in the future, because I did not plan for that. So sometimes we need a plan B for that thing that works for us, that routine. Sometimes we need an alternative when there are disruptive situations like holidays or vacations or travel. If getting on the treadmill every day is part of your self-care, when you're thinking about going on vacation or traveling, you're probably going to want to make sure that there's a place where you can spend some time on a treadmill to keep that going. If you're sick or hurt, you may not be able to do that thing that you really like get on the treadmill or to exercise. And so what can you do instead? What can help you get that same need met that you've been meeting with exercise? What's an alternative to that? Again, back to the plan B. When friends or family visit, maybe it's a little bit harder to take time away and to do the things you normally do for your routine self-care, because you want to spend time with your friends and family. You want to spend time with them. You want to be with them. And so, it's harder to do that. But, that's when increments of time becomes important. Like, where you having various time increments of things that you can do. What's something I can do for 5 minutes that might help me just get a little moment of self-care, a mental moment of reflection, and then re-engage with my family and friends. I often tell people, like, one of my other things that I do for self-care is, at the end of the day, I lock myself in the bathroom away from my husband and my cats, because cats that come to the bathroom with you, but mine are all a little needy, which is my fault. I know that, but I need a little break from them sometimes. So 15 minutes, I go in there. Sometimes I just stare at the wall. Sometimes I do my nighttime ritual, getting ready for bed, wash my face, brush my teeth. I've been known to read in there, but it's my 15 minutes away. And so once I have gotten that 15 minutes, I'm ready to go back out, tell everybody good night, get ready to go to bed. It gives me just those 15 minutes time increments. But also during the workday and the weekend, I may not be able to do the same types of self-care activities. So I need things I can do quickly during the workday or the work week, and things that I might have more time with on the weekend. And then overcoming limitations like money and energy and physical abilities and learning new skills. That's why having more than one option is important, or having a different way to get that same need met. And that's why going back to that list that we just were talking about, like this, if this is where you're feeling, here's a whole list of things you could try, instead of that one thing that has been working and maybe it's not working as well as it did. So staying on track. So thinking for yourself, what is a common barrier you face when attempting self-care? And what could you say to yourself when this comes up again? So is time your barrier? Like, finding time to do that? Well, I might have to do some really, like, intervention self-talk with myself that says something like, yes, time is valuable. I personally value time more than a whole lot of other things in the world, but that's why I need to use some of it for self-care, because I cannot enjoy my time that I have off when I am not feeling well, because I haven't been doing the things I need to do, when I'm not sleeping, when I'm not leaning into the things that fill me up and bring me joy. Because when I do those things, I have more time for myself. I have more time and energy and capacity for stress, and for my job, and for the people who rely on me, and also for myself. I have more time for myself when I'm taking care of myself. Okay, so ideas for getting started, and we've talked a little bit about these already, but identify things you already do that you'd like to continue, And maybe there's some things you thought you would like to do, or you tried and you thought this might be a good thing to try, but you did, it kind of fell off your radar. Maybe go visit that again. Start very, very small, because this is how we build momentum and motivation. Give yourself something to feel proud of. Start, sometimes we think, I need to start exercising and I'm going to do it 3 times a week. And I'm going to do yoga. So I may have a little bit of experience with yoga, but I wouldn't know where to start with that. So my very, very small thing to start towards that goal of doing yoga 3 times a week might be doing a little research on some apps, asking some friends where they like to go, what they enjoy about yoga, what kind of types of yoga, do they have a video they like? I might do a little bit of research about that. Do I want to do it at home? Do I want to go to a studio? I can start small by making those small steps like that. And then maybe I can say, okay, in the next 2 weeks, I'm going to go to yoga or participate in yoga in some way one time. And so now my goal might be like, I'm going to make sure that I do it at least once a week. If I do it 2 or 3 times, that's even better. But I'm going to hold myself to once a week. And then I might start holding myself to twice a week. And then I would work myself up to 3 times a week. But the momentum keeps the motivation going. Because when I just say I'm going to do it 3 times a week and I start showing up and then I don't have a plan for that and I haven't built myself into it, or I'm not even sure I want to do it or where I want to do it, all those things, they kind of seep away my motivation and I'm less likely to do it. Go back to those notes we wrote and identify 2 or 3 things you'd like to try. Notice any areas that were especially difficult to generate ideas and spend more time on that area. Consider an accountability partner. And you don't have to work on the same exact thing. You could just be like, what are you doing? What you said you wanted to work on mind. What are some things you're doing to stimulate your mind? You said that was one of your goals. Have you been doing that? Just somebody to talk about but it could also be a health coach or a therapist. Therapists and health coaches are great accountability partners. What are your goals? What have you done since the last time I've seen you? When you know somebody's going to ask you, you're more likely to do it. Consider habit stacking. For people who are neurodivergent, they know how great this one is, because when you start doing something new, it's really hard to put it as part of it, to start something new and make it cold, like a cold start. But when you add it to something you're already doing, you're more likely to do it. So like if I wanted to really focus on practicing deep breathing, on a routine basis, and not just when I'm thinking, oh gosh, I should take a really deep breath right now. But if I want to practice it on a regular basis for self-care, I might stack that with another habit. So what's one thing I know I'm going to do every day? I know I'm going to get out of bed, brush my teeth, and wash my face, and then get in the shower. So maybe I'm going to get out of bed in the morning. I'm going to wash my face. I'm going to brush my teeth, and I'm going to take 2 or 3 good cleansing breaths, breathing in through my nose, holding at the bottom and breathing out. And then I'm going to get in the shower, because what I'm doing is I've got the practice going, but it's all in the middle of something I'm already doing. I don't have to find a new place for it. Keep a reminder list or photo on your phone, because that's the hardest part. When I need something, I don't know where that list is. So like, sometimes we know, I know I need something, but I don't know what I need. And so having that list there or on your phone, or keeping that list in your planner, is a way to do that, because these written or visual reminders are really helpful to keep us on track as well. And here are some that Rhonda shared in her group that I thought were really good. She let me share here. So, going back, some of these are COVID based, but thinking about those work-life boundaries, like here are some boundaries. I will only enter grades on Wednesdays. I will use an out of office email after 5. I will not do work on Friday or Saturday evenings. I will stop working by 9 p.m. during the work week. If I write these down and I post them on a Post-it somewhere where I'm going to see it, I'm more likely to keep those boundaries and enforce them, not only for my others, but for myself. Then thinking back to that increments of time thing, I may not have time to do a whole lot right now. Maybe I only have 5 minutes. So what are 3, she has 9 different things that she can do in 5 minutes. What are things I do if I have 15 minutes or 30 minutes or 1 to 2 hours? So having a self-care plan to go to when you need something is a great way to actually implement and maintain self-care in your life. Okay, so what happens when we have just a few minutes and I'm wrapping up? So what do we do? What happens when we know that self-care isn't enough, right? Sometimes we need help. Back to that ideal about sometimes self-care is knowing when you can't, it's not self-reliant, it's self-care. And sometimes that means knowing when you need help. So looking for these ideas. how intense are you having discomfort or symptoms that seem intolerable? How intense is it? How long has it lasted? Are they lingering after an experience is over, or do they seem to hang on? Are they harder to let go? Are they interfering with things? Does worry get in the way of what you want to do? It's hard to stop worrying. You worry too much about too many things. Are you triggered by things? Are there things that cause anxiety or stop you from doing things because you are avoiding them? How do they affect your overall life? Would life be significantly different if you didn't have anxiety or depression? Maybe it's time to seek help. At UK, we have multiple ideas for you all about where you can seek help for mental health. Obviously, there's therapy here at Health and Wellness with the mental health therapist, and then there's also UK psychiatry, which is tends to have a little bit of a longer wait time, but they take our HMO and PPO insurance. IRAF Clinic is a great resource. I send people there for couples counseling a lot. I've gotten really good feedback from them. They are student interns, but they're supervised. And so it's kind of like going to Lexington Healing Arts. The new massage therapists are so focused on doing it the right way that you kind of get a really good experience. So I really encourage you all to try the IRAF Clinic if you're looking for somebody to see for couples or individual therapy. They actually see UK employees for $25 a session, which is less than your copay for most things. Clinics, Team Blue and Family Community Medicine both have specialized services that you can go to if your patient's there. Obviously, private therapy. And then Live Health is an online that's zero copay. It's an option for both HMO and PPO. They are 24/7 service, so it's a little bit easier to get in with them. They have multiple service providers. You get to choose from them. They have both psychiatry and therapy. And then, of course, the Suicide Crisis Lifeline, which is the 988 which you can call anytime and call or chat, and it's free and confidential. And one of my presentations, they asked us about acute crisis supports. And so like for supervisors, when they have somebody, either themselves or someone else that they want to try to get help more quickly for. And so obviously the first line is defense is the acute crisis supports. And also the hospitals have started the empathy program, and I only know enough to be dangerous. So I'm just going to tell you that's what it's called. But it is also, it's a crisis service that's getting started up, and is an option for you as well. You'll probably see more of that on the UK now. So look for that. And if you're interested in it, I can send you information as well. It's just not good at talking about it yet. And then Live Health is obviously another way to get quickly into services. And then our services here at Health and Wellness as well. So we provide mental health counseling for 5 free sessions a year for employees, sponsored dependents, and retirees. It's confidential and free. We both provide in-person and telehealth formats. It is individual counseling. We don't do couples counseling. We will see like families, like children and families in certain situations, but for one, we don't do couples counseling, and it's mostly individual counseling. So you can make an appointment by using the QR code or by calling the 859-257-9355 option 1 and speaking to Julie. She's also your best connection. If you have somebody that you're concerned about that might need a crisis appointment, or you feel needs services more quickly, we will consult with you on that and then triage. If it's something that we can provide, we have the capacity to provide a crisis appointment, or if it's something that meets the criteria for that, we will make room for them on our schedules. So, but it's always we're always open for you all to come and talk to us about what your needs are, and for us to resource with you if nothing else. So we're always a resource. Whether we can provide that individual session, we will when we can, but sometimes it doesn't meet the criteria for what we would send you to either 988, or we would suggest the Ridge, or there are other places that might be more appropriate than us at that point in time. So, but use this as a resource. So I am right up on time. So I'm going to say thank you all very much, and appreciated your time today. I will send you this PDF of the presentation so you can make your notes on that. And I'd love to hear your questions or feedback. Please feel free to email me. You'll get my email when I send the PDF out. And I apologize for running out of time, but I know everybody needs to go to lunch, get back from lunch if you're using lunchtime. So I'm going to go ahead and say goodbye. And thank you all so much for your time today. And I hope you have a wonderful week and take care.